COPD is an important cause of morbidity and mortality and is estimated to be the third leading cause of death worldwide. Much of the disease burden remains undiagnosed, and early detection through case-finding interventions have been advocated. However, an analysis of a large COPD case-finding study in the West Midlands, UK, suggested that early detection alone may not improve clinical care for patients with previously undiagnosed disease. Furthermore, there has been little qualitative research examining factors that influence the ability of primary care clinicians to diagnose COPD. We conducted 20 interviews with general practitioners, nurses, and practice managers who had participated in a large case-finding trial. We asked questions about their views on case-finding and barriers and facilitators to making a diagnosis. Participants reported both potential benefits and harms associated with case-finding. Benefits included improved smoking cessation and other lifestyle behaviors, improved disease prognosis, and enabling the early provision of appropriate health care. Harms included the impact on limited healthcare resources, the risk of overdiagnosis, causing anxiety, and increasing insurance costs for patients. A number of barriers to diagnosing COPD were described, including healthcare and patient factors. This included limited time and resources, insufficient expertise, and limited access to diagnostic services. Patient factors included poor attendance, late presentation, under-recognition of symptoms, and poor awareness of COPD. Factors that improve the diagnosis of COPD were also described. These included the education and training of health professionals about COPD and the use and interpretation of spirometry and educating the public about COPD and its symptoms. Participants also discussed the merits of widening access to community respiratory services, specialist COPD nurses, support from secondary care, and sharing diagnostic services in primary care. Finally, participants commented on how patients responded to receiving a diagnosis of COPD. Some accepted the diagnosis, made positive lifestyle changes including quitting smoking, and were occasionally relieved by understanding the cause of their long-term symptoms. However, patients were often shocked and upset by the diagnosis. Some were in denial, and the new diagnosis did not always lead to positive changes in health behaviors. Primary healthcare providers see both potential benefits and risks associated with case finding for COPD. These benefits and risks need to be empirically tested in the follow-up of case finding trials. The diagnosis of COPD may be improved by increasing access to community respiratory services and investing in the training of healthcare professionals on COPD and the use of spirometry. Finally, the knowledge and attitudes of the public about COPD and its symptoms should be investigated to inform future education and awareness-raising initiatives and help those with undiagnosed disease get early access to the appropriate care.